welcome to section 2 of immunology. In this section, we'll be discussing acute inflammation. Acute inflammation is the immediate and transient response to tissue injury, pathogens, or necrosis, and it's mediated by the innate immune system. And the inflamed tissue itself will reveal neutrophil infiltration and tissue swelling. So let's briefly talk about the general function of neutrophils. Neutrophils will rapidly invade the connective tissue in order to phagocytose the pathogens or the necrotic debris. And it's important to recognize that phagocytosis will deplete the neutrophil glycogen, and this causes the neutrophil to die through apoptosis, and this forms pus. So here's something you should really lock away in your head. Any evidence of neutrophil infiltration or pus should make you think acute inflammation. Now, this is true even if the inflammation has been going on for several months. In other words, something's been going on for 8 weeks, but there's neutrophil infiltration and visible pus, then you think, this isn't chronic inflammation, this is acute inflammation still. This is the overview figure of acute inflammation which takes place in a tissue. There's an insult, or tissue trauma, which then initiates inflammation. Now, this process is very intuitive, as you will see when we move along. So even though it may seem overwhelming now, it will all be very clear to you. Right now, focus your attention on one thing, this neutrophil infiltration, or neutrophil chemotaxis you see here. You can see that there are many arrows pointing toward neutrophil chemotaxis, indicating that acute inflammation largely functions to bring these neutrophils into the tissue. And as mentioned before, the job of these neutrophils is to gobble up all the pathogens or the necrotic tissue. And neutrophils are discussed in more detail in section 3 of this chapter, which is the next video. Next, notice the swelling. All of this inflammation will increase the permeability of the post-capillary venules. So if we stripped away everything else from this image, you can at least remember that when you look at the tissues, you'll see swelling and neutrophil infiltration. This is a histologic image from a tissue during acute inflammation, and you can see increased fluid spaces, or you could call this edema. And also, the neutrophils have left the blood vessel and entered the tissue. So we've established that inflamed tissues will reveal neutrophils and swelling. But there's clearly many things taking place during acute inflammation, as you can see on this image. So let me give you a brief yet solid timeline you can keep in your mind as we move forward. So think about it as what occurs immediately following the insult, then what happens 24 hours later, and then what happens 2 to 3 days later. One of the first things that happens immediately is mast cell degranulation. Also, phospholipase A2 will be stimulated, and this is what leads to prostaglandins and leukotrienes. Also, there will be complement activation. Then, 24 hours later, there will be neutrophil infiltration. And finally, 2 to 3 days later, there will be macrophage infiltration. Then, dendritic cells will travel to the lymph nodes. Okay, so there's tissue trauma, and immediately we get mast cell degranulation and phospholipase A2 stimulation and complement activation. After about 24 hours, we get neutrophil infiltration. Then 2 to 3 days later, we get macrophage infiltration. You can see the macrophage leaving the postcapillary venule and entering the inflamed tissue. So with that timeline, let's go back to the immediate response, starting with the mast cells. So with tissue trauma, the mast cells will degranulate, and the granules that are degranulating will release histamine, which you can see here. Histamine is the first main chemical mediator of acute inflammation, and I'll show you why. Look down at the blood vessels. Notice we have the arterioles on the left in red and the postcapillary venules on the right in blue. Histamine will act on the arterioles, causing vasodilation, and you can see that big bulge in the arteriole to represent this. And when the arterioles dilate like this, it can be seen through the skin as redness, and all of the warm blood flowing through the inflamed tissue can be felt as warmth, and both redness and warmth are cardinal signs of inflammation. We will discuss all the cardinal signs of inflammation soon, but now just appreciate that on this diagram, all the cardinal signs appear in these big red pointy shapes. So we've already introduced redness and warmth, as well as swelling, but you can also see fever and pain. Let's again refocus on histamine. In addition to acting on the arteriole, histamine will act on the postcapillary venule to increase permeability. Now notice these dotted lines along the postcapillary venule. All of these gaps along this venule are here to help you recognize that it's easier for things to cross the endothelial wall and enter the tissue. For example, the neutrophils and macrophages. The mechanism for exactly how histamine increases vascular permeability is multifactorial, and it's not necessary to dive into those details. The important thing is to know where this happens, which is the postcapillary venule. In addition to allowing cells to enter the tissue, you can also have fluid enter the tissue, which is where we get swelling. So here's what's written in your text about mast cells. Mast cells are present in nearly all connective tissue. This means that no matter where the tissue insult occurs in the body, mast cells will respond. And mast cell degranulation releases histamine. And this degranulation can be triggered by tissue injury, which we just discussed with the diagram. But degranulation can also be triggered by two complement proteins, C3a and C5a. This shows how the complement system can actually complement or help facilitate acute inflammation. And the details of the complement system are discussed in more detail in section 5 of this chapter. Another way to degranulate mast cells is through IgE cross-linking. This image demonstrates IgE cross-linking. This occurs when a single allergen binds to multiple adjacent IgE antibodies. For example, here you can see the antigen has bound two IgE antibodies, and the mast cell has IgE receptors. And when multiple IgE receptors are stimulated through a single antigen like this, the mast cell will degranulate. So we have the granules here, they're degranulating, and they release histamine. And for the sake of being thorough, we want you to recognize that the granules also contain tryptase. But this really isn't the focus for acute inflammation. You should really be thinking about histamine. Tryptase is more relevant for other processes, which we get into later in this chapter. And as we mentioned before, histamine actions include local vasodilation of arterioles, which will lead to redness and warmth, and histamine will also cause local increased permeability of the postcapillary venules, and this causes swelling. So going back to the diagram, we can see the arterioles and the postcapillary venules at the bottom being acted upon by histamine. But clearly, histamine isn't the only chemical that can cause these symptoms or act on the arterioles and postcapillary venules. For example, you can also see that prostaglandins and bradykinin can perform these actions. So let's focus more on prostaglandins right now. So here's what happens. There can be tissue trauma, which will cause phospholipase A2 stimulation. This will lead to increased production of leukotrienes and prostaglandins. So let's just focus more on prostaglandins for now. Like histamine, prostaglandins will act locally to increase arterial vasodilation and increased permeability of the postcapillary venules. Prostaglandins will also increase pain. Here's what happens. Normally, the nerve endings in the local inflamed tissue will respond to bradykinin, and this causes that sensation of pain. Well, prostaglandins come in and actually increase the sensitivity that the nerve endings have to bradykinin. So in this way, prostaglandins cause pain. Now that we know generally how prostaglandins are involved in acute inflammation, let's clarify this entire process in more detail on a new slide. This slide describes the arachidonic acid pathway. Arachidonic acid precursors are located on the membranes of many cells, and tissue injury will stimulate phospholipase A2 and cause it to release arachidonic acid, and this gets released from the phospholipid bilayer. Arachidonic acid can then be acted on by enzymes, including cyclooxygenase, abbreviated COX, and there's two types you need to know about. That would be cyclooxygenase 1 and cyclooxygenase 2. When this enzyme is activated, the arachidonic acid will be converted to prostaglandins. However, the other enzyme can also be activated, and this is 5-lipoxygenase. And when this is upregulated, arachidonic acid will be converted to leukotrienes. There's several prostaglandins you need to know about. These include prostaglandin I2, D2, and E2. All three of these can cause arterial vasodilation and postcapillary venule permeability. However, prostaglandin E2 specifically has two additional important actions. One is increasing nerve ending sensitivity to bradykinin, and this is where pain comes in. And to understand the next role of prostaglandin E2, you need to know that macrophages release IL-1, interleukin 1, and tumor necrosis factor, or TNF. IL-1 and TNF will travel to the hypothalamus, and there will stimulate cyclooxygenase, causing it to produce prostaglandin E2 locally. And prostaglandin E2 will act locally to increase the temperature set point in the hypothalamus, and this is where fever comes from. Let's go back to this image. We just highlighted three prostaglandins you need to know about for acute inflammation: PGI2, PGD2, and PGE2. All three of these prostaglandins act on the vasculature, which you can see down here, which is why prostaglandins can cause redness, warmth, and swelling. However, only prostaglandin E2 will cause fever. Now briefly turn your attention over to the macrophages here on the right. Later during acute inflammation, recall 2 to 3 days later, macrophages will infiltrate the inflamed tissue and perform many activities, one of which is the release of IL-1 and TNF. These will act locally in the inflamed tissue to upregulate the production of prostaglandins. So going back to prostaglandins on the left, we can see IL-1 and TNF. So as a brief review, if IL-1 and TNF are causing the creation of more prostaglandins, what enzyme are they upregulating? That would be cyclooxygenase. So remember, cyclooxygenase enzymes are responsible for creating prostaglandins. And lastly, IL-1 and TNF will travel to the hypothalamus to stimulate the production of prostaglandins there. So we show the hypothalamus here, and when IL-1 and TNF act here, they will upregulate prostaglandin production, again, through cyclooxygenase enzymes, and PGE2 specifically will act locally and tell the hypothalamus to increase the temperature set point, causing fever. Now let's dive into the leukotrienes. Leukotrienes have two important actions. They can upregulate neutrophil chemotaxis, which you can see with this arrow, and they can cause smooth muscle constriction. This slide lists the leukotrienes of acute inflammation, and there are four you need to know about: leukotriene B4, leukotriene C4, D4, and E4. So B, C, D, E in that order. LTB4 differs from the others because it will increase neutrophil chemotaxis, while the other three will cause smooth muscle constriction. This includes the smooth muscles around the bronchioles, which, if constricted, can cause bronchospasm. In fact, there are medications for asthma patients that aim to block leukotriene production or prevent leukotriene activity to prevent this bronchospasm. And with this smooth muscle constriction, LTC4, D4, and E4 can increase vascular permeability. And they do this because the endothelial cells have pericytes surrounding them, and they cause them to contract. And when they contract, this will open gaps in the vasculature, making it more permeable. So this is yet another way in which acute inflammation can increase tissue swelling. Moving on, when there's tissue trauma, pathogens may gain entry, and these pathogens serve as signals to neutrophils, directing them toward the area they need to clean up. So that's one more mechanism directing neutrophil chemotaxis. During acute inflammation, complement will also be activated. As I mentioned before, complement will be discussed in section 5, but for now, just know that C5a, C3a, and C3b are all produced. C5a acts to increase neutrophil infiltration and chemotaxis. C3b is useful because it helps opsonize bacteria. Opsonins are molecules that bind to pathogens, making it easier for phagocytes to grab onto and eat the pathogens, or phagocytose the pathogens. And this opsonization with phagocytosis is demonstrated here. You can see the dendritic cell engulfing this pathogen surrounded by C3b. And you can see the same thing with the macrophage. It's phagocytosing this pathogen that's covered in C3b. Now bring your attention over to the left. As we mentioned before, C3a and C5a also help stimulate mast cell degranulation. So these three complement proteins have multiple roles in acute inflammation. And here's what's written in your text. Just remember that in acute inflammation, complement activation will occur, which will increase C5a, C3a, and C3b. C5a will increase neutrophil chemotaxis. C5a and C3a together will stimulate mast cell degranulation, and C3b increases opsonization. Okay, so we've just explained the immediate activities in acute inflammation, including mast cell degranulation, phospholipase A2 stimulation, and complement activation. And we know that 24 hours later, neutrophil infiltration will take place. Now let's discuss what will happen 2 to 3 days later. This includes macrophage infiltration and dendritic cells traveling to the lymph nodes. So 2 to 3 days later, macrophages will infiltrate the tissue, and they will help mediate inflammation by releasing several things. For example, they can release IL-1 and TNF. As you can see, IL-1 and TNF are important for many activities in acute inflammation. As we already discussed on the far left, IL-1 and TNF will upregulate prostaglandin production. Macrophages can also release IL-8. This will upregulate neutrophil chemotaxis. Lastly, I've indicated that macrophages can initiate possible abscess formation. This is discussed in more detail in section 8 when we dive into macrophage activities. And of course, macrophages will phagocytose pathogens while they're here. And this is aided through opsonization, and one opsonin we've just talked about is C3b. Now something similar takes place with dendritic cells. These, with the help of opsonization, will phagocytose pathogens, then they will travel and enter lymph, which you can see here, and then travel to the lymph node. At the lymph node is where dendritic cells will perform antigen presentation. This will lead to activation of the adaptive immunity and chronic inflammation. And chronic inflammation is discussed in section 6 of this chapter. So here's what's written in your text regarding macrophages and dendritic cells in acute inflammation. So dendritic cells and macrophages will release IL-8, which causes neutrophil chemotaxis, IL-1, and TNF, which contributes to fever, redness, warmth, and swelling. And again, that's largely through upregulating prostaglandins. And dendritic cells will process antigens after they phagocytose them and travel to the lymph nodes and present antigens to naive T cells. And this is how acute inflammation connects to chronic inflammation and the adaptive immune system. And lastly, macrophages can initiate possible abscess formation. So now wrapping this up, remember that the two big things that you'll see in the tissue are neutrophil chemotaxis, lots of neutrophils, and swelling. So these are what you see in the tissue. All these other things take place, but these are the things that you can see on histology: swelling and neutrophils, and pus, which is caused by neutrophils. Now, the last thing I want to do is emphasize those cardinal signs of inflammation: swelling, warmth, redness, pain, and fever. Redness occurs because of histamine, prostaglandins, and bradykinin. Going back to this image, we can see down here, we've listed histamine, prostaglandins, and bradykinin. We haven't talked about the mechanism of bradykinin, but we will in section 4 of this chapter. Also, warmth occurs because of histamine, prostaglandins, and bradykinin, and swelling occurs because of histamine, prostaglandins, and bradykinin. So hopefully you can see why histamine, prostaglandins, and bradykinin are so high yield. They really contribute to 3 of the 5 signs of cardinal inflammation. In fact, pain is initiated by prostaglandin E2 and bradykinin, because remember, prostaglandin E2 upregulates the nerve ending sensitivity to bradykinin. So there again, prostaglandins and bradykinin. And then fever is mediated by prostaglandin E2, again, a prostaglandin. And the last cardinal sign of inflammation you should know about is loss of function. This doesn't always occur, but it can occur. For example, pain may reduce voluntary movement. So if the patient's in so much pain, they just might not move as much, and that's a loss of function. Another example is the swelling may actually limit the normal range of motion. For example, if somebody's ankle is so swollen, they can't really walk on it as they normally should. And now that we've covered acute inflammation, let's review with a question. How do macrophages contribute to the cardinal signs of inflammation? Well, recall that the cardinal signs of inflammation include fever, redness, warmth, swelling, and pain. And how do macrophages lead to these findings? Well, it's primarily through their release of TNF and IL-1. Both of these will upregulate cyclooxygenase, which will lead to more prostaglandins. And all of the prostaglandins will contribute to redness, warmth, and swelling. And prostaglandin E2 is what specifically leads to fever and pain. So going back to this image, we see IL-1 and TNF. They upregulate prostaglandin production, leading to pain, fever, and down here we can see that prostaglandins cause arterial vasodilation, causing redness and warmth, and they can also increase permeability of the postcapillary venules, leading to swelling. And that concludes this section.